Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Welcome back, everyone, to Policy and Rights. I am Michael Clogs, and today we had the inauguration of Joseph R. Biden as the 46th President of the United States. In his inaugural speech, he said a lot of things in the hopes of uniting the people of the United States, the citizens, back to come together, because going into the election and coming up to this point, America has been very divided, and the former leadership and the former president played on that division and used it to try to get what he wanted. And the new president, Joe Biden, is attempting to reunite the people, bring back a place of calm and democracy back to America. As well as doing that, he's also trying to bring America back to the place of greatness that they were, in sitting at many different tables regarding climate change, global health, and helping to be part of the global governing body.
My fellow Americans, a moment we have all been waiting for. It is now my great privilege and high honor to be the first person to officially introduce the 46th President of the United States, Joseph R. Biden, Jr.
Chief Justice Roberts, Vice President Harris, Speaker Pelosi, Leader Schumer, Leader McConnell, Vice President Pence, my distinguished guests, my fellow Americans. This is America's day. This is democracy's day, a day of history and hope, of renewal and resolve. Through a crucible for the ages, America has been tested anew, and America has risen to the challenge. Today, we celebrate the triumph not of a candidate, but of a cause, the cause of democracy. The people, the will of the people, has been heard, and the will of the people has been heeded. We've learned again that democracy is precious. Democracy is fragile. And at this hour, my friends, democracy has prevailed. So now, on this hallowed ground where just a few days ago, violence sought to shake the Capitol's very foundation, we come together as one nation, under God, indivisible, to carry out the peaceful transfer of power as we have for more than 2 centuries. As we look ahead in our uniquely American way, restless, bold, optimistic, and set our sights on the nation we know we can be and we must be. I thank my predecessors of both parties for their presence here today. I thank them from the bottom of my heart. And I know And I know the resilience of our Constitution and the strength of our nation, as does President Carter, who I spoke with last night, who cannot be with us today, but whom we salute for his lifetime in service. I've just taken the sacred oath each of those patriots have taken. The oath first sworn by George Washington. But the American story depends not on any one of us, not on some of us, but on all of us, on we the people who seek a more perfect union. This is a great nation. We are good people. And over the centuries, through storm and strife, in peace and in war, we've come so far. But we still have far to go. We'll press forward with speed and urgency, for we have much to do in this winter of peril and significant possibilities. Much to repair, much to restore, much to heal, much to build, and much to gain. Few people in our nation's history have been more challenged or found a time more challenging or difficult than the time we're in now. Once-in-a-century virus that silently stalks the country. It's taken as many lives in 1 year as America lost in all of World War II. Millions of jobs have been lost. Hundreds of thousands of businesses closed. A cry for racial justice, some 400 years in the making, moves us. The dream of justice for all will be deferred no longer. A cry for survival comes from the planet itself, a cry that can't be any more desperate or any more clear. And now, a rise of political extremism, white supremacy, domestic terrorism, that we must confront and we will defeat.
It's 9 hours.
To overcome these challenges, to restore the soul and secure the future of America, requires so much more than words. It requires the most elusive of all things in a democracy: unity. Unity. In another January, on New Year's Day in 1863, Abraham Lincoln signed the Emancipation Proclamation. When he put pen to paper, the president said, and I quote, "If my name ever goes down into history, it'll be for this act, and my whole soul is in it." My whole soul is in it. Today, on this January day, my whole soul is in this. Bringing America together, uniting our people, uniting our nation. And I ask every American to join me in this cause. Uniting to fight the foes we face: anger, resentment and hatred, extremism, lawlessness, violence, disease, joblessness, and hopelessness. With unity, we can do great things, important things. We can right wrongs. We can put people to work in good jobs. We can teach our children in safe schools. We can overcome the deadly virus. We can reward work and rebuild the middle class and make health care secure for all. We can deliver racial justice, and we can make America once again the leading force for good in the world. I know speaking of unity can sound to some like a foolish fantasy these days. I know the forces that divide us are deep and they are real. But I also know they are not new. Our history has been a constant struggle between the American ideal that we're all created equal and the harsh, ugly reality that racism, nativism, fear, demonization have long torn us apart. The battle is perennial, and victory is never assured. Through Civil War, the Great Depression, World War, 9/11, through struggle, sacrifice, and setbacks, our better angels have always prevailed. In each of these moments, enough of us have come together to carry all of us forward. And we can do that now. History, faith, and reason show the way of unity. We can see each other not as adversaries, but as neighbors. We can treat each other with dignity and respect. We can join forces, stop the shouting, and lower the temperature. For without unity, there is no peace, only bitterness and fury. No progress, only exhausting outrage. No nation, only a state of chaos. This is our historic moment of crisis and challenge. And unity is the path forward. And we must meet this moment as the United States of America. If we do that, I guarantee you we will not fail. We have never, ever, ever, ever failed in America when we've acted together. And so today, at this time, in this place, let's start afresh, all of us. Let's begin to listen to one another again, hear one another, see one another, show respect to one another. Politics doesn't have to be a raging fire, destroying everything in its path. Every disagreement doesn't have to be a cause for total war. And we must reject the culture in which facts themselves are manipulated and even manufactured. My fellow Americans, we have to be different than this. America has to be better than this. And I believe America is so much better than this. Just look around. Here we stand in the shadow of the Capitol Dome, as was mentioned earlier, completed amid the Civil War, when the Union itself was literally hanging in the balance. Yet we endured. We prevailed. Here we stand, looking out on the great mall where Dr. King spoke of his dream. Here we stand where 108 years ago, at another inaugural, thousands of protesters tried to block brave women marching for the right to vote. And today, we mark the swearing in of the first woman in American history elected to national office, Vice President Kamala Harris. Don't tell me things can't change. Here we stand, across the Potomac from Arlington Cemetery, where heroes who gave the last full measure of devotion rest in eternal peace. And here we stand, just days after a riotous mob thought they could use violence to silence the will of the people, to stop the work of our democracy, to drive us from this sacred ground. It did not happen. It will never happen. Not today, not tomorrow, not ever. Not ever. To all those who supported our campaign, I'm humbled by the faith you've placed in us. To all those who did not support us, let me say this. Hear me out as we move forward. Take a measure of me and my heart. If you still disagree, so be it. That's democracy. That's America. The right to dissent peaceably within the guardrails of our republic is perhaps this nation's greatest strength. Yet hear me clearly. Disagreement must not lead to disunion. And I pledge this to you. I will be a president for all Americans. All Americans. And I promise you, I will fight as hard for those who did not support me as for those who did. Many centuries ago, St. Augustine, a saint of my church, wrote that a people was a multitude defined by the common objects of their love. Defined by the common objects of their love. What are the common objects we as Americans love that define us as Americans? I think we know. Opportunity, security, liberty, dignity, respect, honor, and yes, the truth. Recent weeks and months have taught us a painful lesson. There is truth and there are lies. Lies told for power and for profit. And each of us has a duty and a responsibility as citizens, as Americans, and especially as leaders. Leaders who have pledged to honor our Constitution and protect our nation, to defend the truth and defeat the lies. Look, I understand that many of my fellow Americans view the future with fear and trepidation. I understand they worry about their jobs. I understand, like my dad, they lay in bed at night, staring at the ceiling, wondering, can I keep my health care? Can I pay my mortgage? Thinking about their families, about what comes next. I promise you, I get it. But the answer is not to turn inward, to retreat into competing factions, distrusting those who don't look like you, or worship the way you do, or don't get their news from the same sources you do. We must end this uncivil war that pits red against blue, rural versus urban, conservative versus liberal. We can do this if we open our souls instead of hardening our hearts, if we show a little tolerance and humility, and if we're willing to stand in the other person's shoes, as my mom would say, just for a moment, stand in their shoes. Because here's the thing about life. There's no accounting for what fate will deal you. Some days, when you need a hand. There are other days when we're called to lend a hand. That's how it has to be. That's what we do for one another. And if we are this way, our country will be stronger, more prosperous, more ready for the future. And we can still disagree. My fellow Americans, in the work ahead of us, we're going to need each other. We need all our strength to persevere through this dark winter. We're entering what may be the toughest and deadliest period of the virus. We must set aside politics and finally face this pandemic as one nation. One nation. And I promise you this, as the Bible says, weeping may endure for a night, but joy cometh in the morning. We will get through this together. Together. Look, folks, all my colleagues I serve with in the House and the Senate up here, we all understand the world is watching all of us today. So here's my message to those beyond our borders. America has been tested, and we've come out stronger for it. We will repair our alliances and engage with the world once again, not to meet yesterday's challenges, but today's and tomorrow's challenges. And we'll lead not merely by the example of our power, but by the power of our example. We'll be a strong and trusted partner for peace, progress, and security. Look, you all know we've been through so much in this nation. And my first act as president, I'd like to ask you to join me in a moment of silent prayer. Remember all those who we lost in this past year to the pandemic. Those 400,000 fellow Americans, moms, dads, husbands, wives, sons, daughters, friends, neighbors, and co-workers. We'll honor them for becoming the people and the nation we know we can and should be. So I ask you, let's say a silent prayer for those who've lost their lives and those left behind and for our country. Amen. Folks, this is a time of testing. We face an attack on our democracy and on truth, a raging virus, growing inequity, the sting of systemic racism, a climate in crisis, America's role in the world. Any one of these would be enough to challenge us in profound ways. But the fact is, we face them all at once, presenting this nation with one of the gravest responsibilities we've had. Now we're going to be tested. Are we going to step up? All of us? It's time for boldness, for there's so much to do. And this is certain. I promise you, we will be judged, you and I, by how we resolve these cascading crises of our era. We will rise to the occasion is the question. Will we master this rare and difficult hour? Will we meet our obligations and pass along a new and better world to our children? I believe we must. I'm sure you do as well. I believe we will. And when we do, we'll write the next great chapter in the history of the United States of America, the American story. A story that might sound something like a song that means a lot to me. It's called American Anthem. There's one verse that stands out, at least for me, and it goes like this. The work and prayers of century have brought us to this day. What shall be our legacy? What will our children say? Let me know in my heart when my days are through. America, America, I gave my best to you. Let's us add our own work and prayers to the unfolding story of our great nation. If we do this, then when our days are through, our children and our children's children will say of us, they gave their best, they did their duty, they healed a broken land. My fellow Americans, I close the day where I began, with the sacred oath. Before God and all of you, I give you my word. I will always level with you. I will defend the Constitution. I'll defend our democracy. I'll defend America. And I'll give all of you, keep everything I do in your service, thinking not of power, but of possibilities, not of personal interest, but the public good. And together, we shall write an American story of hope, not fear, of unity, not division, of light, not darkness, a story of decency and dignity, love and healing, greatness and goodness. May this be the story that guides us, the story that inspires us, and the story that tells ages yet to come that we answered the call of history. We met the moment. Democracy and hope, truth and justice did not die on our watch but thrived. That America secured liberty at home and stood once again as a beacon to the world. That is what we owe our forebears, one another, and generation to follow. So, with purpose and resolve, we turn to those tasks of our time, sustained by faith, driven by conviction, and devoted to one another and the country we love with all our hearts. May God bless America, and may God protect our troops. Thank you, America.
It is my opinion that this is a great day in the United States, that they have a president who does believe in equality and unity around the world, and those beliefs are what make leadership great for all of humanity. So moving on to the next segment will be from the Dr. Etienne of the Pan American Health Organization. She's talking about the vaccinations, the spread of virus, and cautions us to work with our healthcare systems to help keep the viral numbers down and to help protect our healthcare systems.
And kept hospitals functioning up to now. I am particularly concerned for the next few weeks. Throughout our region, especially in North and South America, many hospitals are operating at or very close to capacity. The reports from Manaus in Brazil illustrate what happens when a health system lacks enough capacity to cope with the speed of new infections. But not just Manaus that is at risk. We've had reports of oxygen being rationed in some locations in the United States of America and in Peru. In fact, ICU occupancy rate stands at 90% in some parts of Peru. Several locations in Brazil and in Ecuador are operating close to their limit. In Mexico City, the majority of beds are occupied by COVID-19 patients, and hospital capacity continues to be challenged in countries of the Southern Cone like Chile, Argentina, and Uruguay. In the Caribbean, the first week of 2021 saw the highest number of cases reported since the beginning of the pandemic. Barbados had a 61% increase in new cases over the past 2 weeks, mostly among the local population. And as cases rise, so does the demand for testing, severely stressing laboratory capacity. The new variants detected in the United Kingdom, South Africa, and Brazil are also concerning, as they may be playing a role in accelerating new infections throughout our region. We are studying the effects of variants on transmission, and our genomic surveillance network of some 21 laboratories is tracking the emergence of variants in the region. Still, these factors highlight the fundamental truth that we must intensify public health interventions to limit exposure to the virus. Social distancing, limiting gatherings, and the consistent use of masks in public settings and frequent hand washing are our absolute best hope for reducing the number of COVID-19 infections right now. We can't stress that sufficiently. These measures remain the best option for places that are seeing cases rise to unprecedented levels and hospitals fill up fast. I urge the leadership of our region to embrace these measures to save lives. This is not the time to let our guard down. Of course, vaccines will also help save lives and eventually halt the pandemic. PAHO is both encouraged and inspired by the speed with which COVID-19 vaccines were developed. But we are also aware that there are not yet enough doses to achieve a visible impact on transmission at this point in the short term. Currently, the doses available for use are very limited and will remain in short supply everywhere as manufacturers race to meet global demand over the next few months. The start of immunizations in some countries is the first step, but we have a long way to go to make this a reality for everyone across the whole region, in poor countries, developing countries alike. No one is safe until all are safe. Our vision is one of equity of access to vaccines, and we are working day and night to make this a reality. PAHO and its partners are at the very center of an effort not only to accelerate access, but to ensure that vaccinations reach everyone who wants to receive them. The goal is to start vaccinations in a comprehensive, safe manner, building sustainable campaigns and immunization programs that can help end the pandemic in every country of our region. The COVAX facility remains the most equitable mechanisms to make vaccines available in all countries in the Americas, regardless of the size of their population or their GDP. So far, COVAX has secured agreements for 2 billion doses of vaccines to be deployed this year. This is unprecedented in scale, but also in the fact that the vaccines will reach all participating countries virtually at the same time. At least 7 countries in the Americas are now vaccinating their populations as part of bilateral agreements. COVAX can complement this effort and indeed help other countries to commence immunizations early. COVAX has agreements with AstraZeneca and the Serum Institute of India for the supply of AstraZeneca and Novavax licensed vaccines as soon as these obtain the emergency use listing approvals from the World Health Organization. As we speak, COVAX is actively negotiating deals with Pfizer, and with further announcements what can be expected in the near term. Vaccines are expected to reach countries by March, if not a little earlier. PAHO's revolving fund, which has 4 decades of experience procuring and distributing vaccines, will play a key role in this process, supporting countries along the way. In addition to vaccines, the fund helps member states with the acquisition of syringes, safety boxes, cold chain equipment, and other supplies that allow vaccines to be safely delivered to every corner of our region. So as the delivery times approach, we know that the process will take time due to the demand and supply factors. Countries have only a few weeks to prepare for the vaccine's arrival. Having a comprehensive safe plan in place will greatly facilitate the successful vaccine rollout in any country. All member states participating in the COVAX facility are developing a national vaccine deployment plan that is adapted to their context and their population. These plans cover every step in a vaccine's journey and every stakeholder critical to its success, from the regulatory agencies that issue approvals and monitor safety data over time, to the logistics systems that coordinate delivery of doses and monitor the state of cold chain systems, to the recruiting and training of staff so health personnel throughout the country know how to deliver these vaccines, to the public campaigns to ensure that populations know where and when and why to receive their doses. In the PAHO is helping countries throughout this planning process. So far, 18 countries have shared the national vaccine deployment plans with PAHO for feedback, and 23 countries have completed the vaccine readiness assessment among the local population. The vaccine rollouts already underway are also generating demand for tests for the region, severely stressing laboratory capacity. The importance of variants detected in the readiness of each health South Africa and Brazil, where vaccines will be distributed and administered, as they may be playing a role in accelerating critical new infections to have strong information systems. We are studying the effects of variants on transmission and to track vaccinated, our genomic surveillance network of some 21 laboratories. By heeding these lessons tracking the emergence of variants will be better prepared to introduce the vaccines as soon as the doses. The fundamental truth that we must intensify public health interventions to limit exposure to the virus. Measures by its social distancing, but through the limiting gatherings and the consistent use of masks in public settings and frequent hand washing are our absolute best hope for reducing the number of COVID-19 infections right now. We can't stress that sufficiently. And those at the front lines these measures remain the best option for places that are seeing cases rise to unprecedented levels and hospitals fill up populations that often struggle. I urge the leadership of our region to embrace these measures to save lives. Knowledge and experience this is not the time to let our guard down. Through our seasonal food campaigns, of course, vaccines will also help save lives and eventually halt the pandemic. PAHO is both encouraged and inspired by the speed with which COVID-19 vaccines were developed. But we are also aware that there are not yet enough doses to achieve a visible impact on transmission at this point in the short term. Currently, the doses available for use are very limited and will remain in short supply everywhere as manufacturers race to meet global demand over the next few months. The start of immunizations in some countries is the first step, but we have a long way to go to make this a reality for everyone across the whole region, in poor countries, developing countries alike. No one is safe until all are safe. Our vision is one of equity of access to vaccines, and we are working day and night to make this a reality. PAHO and its partners are at the very center of an effort not only to accelerate access, but to ensure that vaccinations reach everyone who wants to receive them. The goal is to start vaccinations in a comprehensive, safe manner, building sustainable campaigns and immunization programs that can help end the pandemic in every country of our region. The COVAX facility remains the most equitable mechanisms to make vaccines available in all countries in the Americas, regardless of the size of their population or their GDP. So far, COVAX has secured agreements for 2 billion doses of vaccines to be deployed this year. This is unprecedented in scale, but also in the fact that the vaccines will reach all participating countries virtually at the same time. At least 7 countries in the Americas are now vaccinating their populations as part of bilateral agreements. COVAX can complement this effort and indeed help other countries to commence immunizations early. COVAX has agreements with AstraZeneca and the Serum Institute of India for the supply of AstraZeneca and Novavax licensed vaccines as soon as these obtain the emergency use listing approvals from the World Health Organization. As we speak, COVAX is actively negotiating deals with Pfizer, and with further announcements what can be expected in the near term. Vaccines are expected to reach countries by March, if not a little earlier. PAHO's revolving fund, which has 4 decades of experience procuring and distributing vaccines, will play a key role in this process, supporting countries along the way. In addition to vaccines, the fund helps member states with the acquisition of syringes, safety boxes, cold chain equipment, and other supplies that allow vaccines to be safely delivered to every corner of our region. So as the delivery times approach, we know that the process will take time due to the demand and supply factors. Countries have only a few weeks to prepare for the vaccine's arrival. Having a comprehensive safe plan in place will greatly facilitate the successful vaccine rollout in any country. All member states participating in the COVAX facility are developing a national vaccine deployment plan that is adapted to their context and their population. These plans cover every step in a vaccine's journey and every stakeholder critical to its success, from the regulatory agencies that issue approvals and monitor safety data over time, to the logistics systems that coordinate delivery of doses and monitor the state of cold chain systems, to the recruiting and training of staff so health personnel throughout the country know how to deliver these vaccines, to the public campaigns to ensure that populations know where and when and why to receive their doses. PAHO is helping countries throughout this planning process. So far, 18 countries have shared their national vaccine deployment plans with PAHO for feedback, and 23 countries have completed the vaccine readiness assessment tool. The vaccine rollouts already underway are also generating important lessons for the region. We are seeing, for instance, the importance of assessing the readiness of each health facility where vaccines will be distributed and administered. And we're also learning just how critical it is to have strong information systems in place to find target populations and to track vaccinated individuals. By heeding these lessons now, countries will be better prepared to introduce the vaccines as soon as the doses are available. For us in PAHO, a successful vaccine introduction must not simply be measured by its timeline, but through the lens of fairness. We must not let vaccination campaigns fracture along the lines of inequity that have mapped the health of our region. Vaccine rollouts should prioritize those at risk, like healthcare workers and those at the front lines of our response, the elderly, and those with pre-existing conditions. They also should prioritize disenfranchised populations that often struggle to access the care that they need. We have gained important knowledge and experience in reaching these groups. We do it every year through our seasonal food campaigns that protect over 100 million people every year in the region. Additionally, our region has succeeded with other mass vaccination campaigns that have helped us eliminate smallpox, polio, rubella, and measles. We have the tools that we need to move forward. Our member states have a wealth of experience to build on. Our foundation in immunization is strong and will pave the way for success. There are nearly 1 billion people to immunize in our region. The task is daunting, but not unrealistic. It will take many months of hard work, but here in the Americas, we know where to start and we have the resolve to see this through by working together in solidarity and leaving no one behind. Thank you. So let me thank you for this question. I want to sound a note of caution. Countries should not rush vaccination campaigns. Being ready for those campaigns. So let me thank you for this question. Obviously, I didn't realize I was muted for so long. So I was saying that I want to sound a note of caution to countries that they don't rush the vaccination campaigns. Being ready is more important than being quick. And this is the time that the member states in our region must act on being ready to distribute and to vaccinate. From our assessment, most of the countries are not yet ready to roll out vaccines. But they do need to get ready very soon. And so we are urging them to take this time to ensure that everything is in place. We have a checklist that of things that are required. First of all, they need a clear understanding of which vaccine will be delivered to them and how to best adapt the cold chains and other logistics that they will need. Then they need to prioritize the vulnerable groups that need to get vaccinated first. Obviously, those groups would also need to know that they are in the priority. They need to know where to access and how to access the vaccine. Then there are many healthcare professionals that will be engaged in carrying out vaccination that also need to be trained and prepared. And we can't stress sufficiently the communication to the population so that people know when and how each group will have access to a vaccine. I know that many of our member states are concerned that they are lagging behind in terms of the 49 other countries across the world, and most of them high-income countries that have started vaccinating. Let us use this time, virtually less than 6 weeks, to ensure that we have everything in place. And not forgetting also that monitoring must be in place, monitoring for adverse events and any unforeseen challenges as well. Thank you.
Next, we'll hear from Dr. Bonnie Henry, BC health officials, and she's going to talk to us about it has been a slowdown in the Pfizer vaccine to Canada and British Columbia, while the vaccine program is on track to. And they are currently reaching their goals. There could be a slowdown in the number of vaccines received from Pfizer, and there could be a delay in the overall speed of starting up the program. But the program, she believes, will continue. Meanwhile, she is stressing the fact that we need to maintain the social distancing and all other measures such as wearing masks, washing hands, and ensuring that we keep control of the spread of the virus in the general public, thus protecting the most vulnerable and essential workers. So let's listen to what she actually has to say.
It's 19 hours.
As you know, as it was announced last week, Canada has received notice that there will be delays in the Pfizer vaccine supply for this week, but more specifically for next week and the subsequent 2 weeks. Although the supply comes back up again very quickly, next week is where we'll be most affected. We received those numbers over the weekend, and we know that this delay will temporarily slow our delivery into the next phase of at-risk people, particularly into other parts of our hospital system. However, the process we knew was going to be changing and changing frequently, and we know that these challenges with such a large program that's going to be going on for many weeks. We have, however, been able to rearrange and look at the process that we have to make sure that we are continuing with providing the first of 2 doses to those at highest risk, and that we are able to start second doses at day 35 in accordance to our plans that we announced a few weeks ago. So that is our focus over the next couple of weeks. It is a bit of a setback, but it is only a delay. We are expecting to receive and have been reassured that we will receive the extra doses at the end of February and early March to be able to continue to expand our first dose program and to ensure that those at highest risk in our high-risk categories are covered as soon as possible. What that will mean, though, is that the focus will be on second doses starting next week, and the week after, and then we're building back up again to be able to provide additional first doses to those at risk. And as I mentioned, the dashboard will be published this afternoon on the BC CDC website. And we do have to remember that even though our COVID-19 immunization program is underway and continues and will continue in the coming weeks and months, the risks remain high all over British Columbia, and we see that from the numbers over the weekend. This is why we need to continue to take those measures that we know work to stop the spread. It's to keep everybody who has not yet been vaccinated as safe as possible in this period of time of hope and challenge as we move towards being able to provide immunization to everybody. It's also why we continue to have our public health orders and restrictions in place. I do want to pause, though, because the science has shown us, and it shows us now in what we are seeing across the world as people are being immunized, that these vaccines are very effective. And from somebody who's been working in the vaccine world for 30 years, it is amazing to us that we can have in such a short period of time a new technology that is 95% effective in protecting somebody from a new disease, and even more effective at preventing people from having severe illness and dying from COVID-19. This is amazing to all of us, and it's what we need to focus on to keep us going through this period of time until more vaccine comes and we can protect more of our community. Right now, it's our individual efforts that will have the biggest impact, and we can't yet rely on vaccine to protect all of us. In the next few months, though, we will have more and more people protected. And although today we have a slight delay, we are still on track to protect those most vulnerable by the end of March, and starting in April to expand dramatically the access to vaccine to people across the province to protect us all. For now, stopping transmission in our communities keeps our long-term care homes safe. Stopping transmission in our communities keeps our schools and our workplaces going and safe. The biggest risk and the biggest variance we have right now is all of us, our human behavior, the choices that we make every day. So no matter what variant of the virus is circulating in our communities, we know we need to stop the spread in the same way that we have been doing for the last 11 months. We have the tools, and it is in our control. That means keeping our safe distance when we're with others, particularly in indoor public places. No social gatherings, even small gatherings we have seen, can spread this virus to the people we are closest to, and that is what we want to avoid at this period of time. Wearing masks when we're in indoor public places, covering our cough, cleaning our hands regularly, and staying home if we're not feeling well. And of course, getting tested if we have any concerns at all. Let's show each other that we remain committed to doing our part to protect our seniors and elders who've not yet had the vaccine, even as we have more of this protective vaccine in our communities. But we need to protect our neighbors, our families, our loved ones, and do this to support all of our essential workers who are there for us every day. Across our province, today and tomorrow and for the next few weeks, everything we do will make a difference. And as always, we do this in the spirit of kindness and staying calm and being supportive of each other and staying safe. Thank you.
Okay, thank you for listening, everybody. We want to thank, as a company and as a podcasting system and internet radio station, Joe Biden on taking office. And in his first days, he has written and signed 18 executive orders that will reverse a lot of what Donald Trump had done. he is trying to change the legacy of the United States back to one of helpfulness and kindness. He is trying to put behind the disruption and the separatism that was caused by the former president, and he's trying to move forward with real democracy and the idea that the people are in charge and that the people of and the citizens of the country should be listened to when trying to make policy, and that there are people out there who just simply need help and should be given help when one lives in such a rich country. It is a lesson to all of us who live in the richer countries to be able to help those who need it is a privilege, and a privilege that we should take in a very responsible manner. Thank you for listening again. You've been listening to Policy and Rights here on Depictions Media Radio, and I am Michael Clogs. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.